Question number 1. The ideal time to initiate breastfeeding after PUD is. The correct option is C. First hours. Question number 2. A baby born without 37 week of gestation is classified as. The correct option is B. Frida. Question number 3. The vaccine for measles is administered at. The correct option is D. 9 months. Question number 4. The target year for achieving universal immunization in India was. The correct option is A. 1985. Question number 5. The normal cardiac output for an adult is approximately. The correct option is C. 3 to 6 liters per minute. Question number 6. The drug is used to treat diabetic ketoacidosis. The correct option is B. Insulin. Question number 7. The 4-gene system and immunization ensures. The correct option is A. Vaccine efficacy. Question number 8. The most common symptom of urinary tract infection is. The correct option is C. Dysuria. Question number 9. Classic symptom of Cushing's syndrome is. The correct option is D. Moon face. Question number 10. The average duration of the first stage of labor in a Fermi Grivideva is. The correct option is C. 12 to 14 hours. Question number 11. A sudden drop in blood pressure when changing position is called. The correct option is D. Orthostatic hypotension. Question number 12. The best indicator of the health status of a community is. The correct option is D. Infant mortality rate. Question number 13. A persistent belief that is contrary to reality is known as. The correct option is B. Delusion. Question number 14. Which drug is commonly used for bipolar disorder? The correct option is A. Lithium. Question number 15. Which vitamin is essential for blood clotting? The correct option is D. Vitamin K. Question number 60. The normal ejection fraction of the heart is. The correct option is C. 50 to 70%. Question number 70. The best method to sterilize surgical instrument is. The correct option is C. Autoclaving. Question number 18. Which hemoglobin is the first to respond during an infection? The correct option is C. RNGL. Question number 19. Which position is recommended for a patient in a respiratory distress? The correct option is B. Semifolars. Question number 20. The normal range of arterial blood pH is. The correct option is B. Question number 21. The most common site of fracture and osteoporosis is. The correct option is C. Hip. Question number 22. Which vitamin promotes calcium absorption in bones? The correct option is A. Vitamin D. Question number 23. The nurse should perform hand hygiene for at least. The correct option is C. 20 seconds. Question number 44. A patient with cyanosis is likely experiencing. The correct option is A. Hypoxemia. Question number 25. The antidote for benzodiazepine overdose is. The correct option is D. Flasmonil. Question number 26. Which antibiotics is known as to cause arthrotoxicity? The correct option is C. Gentamicin. Question number 27. An efficient lead COPD, the variety oxygen saturation target is. The correct option is A. 88 to 92%. Question number 28. In nursing, the first step of nursing phrases is. The correct option is C. Assessment. Question number 29. Which term describes a false text belief? The correct option is B. Delusion. Question number 30. Electroconvulsive therapy is most commonly used for. The correct option is C. Severe depression. Question number 31. Which medication is used to treat iron overdose? The correct option is C. Deferazamine. Question number 32. The recommended amount of folic acid during pregnancy is. The correct option is B. 400 microgram per day. Question number 33. Which neurotransmitter is primarily involved in depression? The correct option is A. Serotonin. Question number 34. The nurse's first priority in a psychiatric emergency is to. The correct option is B. Ensure safety. Question number 35. Which medication is classified as A. Proton pump inhibitor? The correct option is D. Omeprazole. Question number 36. What is the most common site for peptic ulcer? The correct option is A. Duodenum. Question number 37. Which precaution is used for a patient with tuberculosis? The correct option is C. Earwatten precautions. Question number 38. What is the primary focus of primary health care? The correct option is B. Preventive services. Question number 39. What is the average duration of a normal menstrual cycle? The correct option is B. 28 days. Question number 14. which is the most common side for intramuscular injection in adults. The correct option is C. Gluteus maximus.